For all the details on what happened to me regarding my injury, we're pushing 100 hours plus video now. YouTube channel, My Medical Nightmare. I was doing some research on Birmingham, Alabama-based radiologist group, Vulcan Associates, and I found this article dated from March 2021. The title is Vulcan Imaging Gives Around the Globe. They had a need, says Eric Blackman, CEO at Vulcan Imaging Associates. That's all it took for the 30 radiologists at the medical group to agree to donate their time to read hundreds of x-rays per month from Christ Health Center, a local non-profit medical facility. That was 3+ years ago. Since then, the center's needs have grown, and so has VIA's commitment to them. We are their only source for interpreting all their work, including ultrasounds, which are a new service, Blackman says. At their 4 Birmingham locations, Christ Health Center served 21,500 patients from the area's underserved population, offering primary care services from their staff of 44 providers plus pharmacists, counselors, and a dentist. Blackman estimates VIA radiologists read 20 to 50 ultrasounds a month now in addition to the x-rays, but he expects that number to rise rapidly, and any one of our radiologists can read them when they come in. This is a group-wide effort. VIA even provides the clinic with file storage through its partnership with FINAO Solutions in Huntsville. I wanted to highlight this collaboration and just remind everyone that I had experience dealing with both Vulcan Imaging Associates doctors and Christ Health Center. Neither organization is trustworthy or reputable. I'm not sure if this partnership continues through the present day, February 2026. And I'll go into the details about what happened to me when I visited 2 Christ Health clinics, a nurse and a doctor, and had a $700 MRI scan misread by Vulcan Imaging neuroradiological specialist Dr. Michael Brant Ruff. I remember reading that the new Christ Health pediatric clinic that opened off of Parkway East near Roebuck in Birmingham in the summer of 2025 was going to offer diagnostic imaging services. So yeah, it will be interesting to know if Vulcan Imaging is still reading those scans for them. If this is the case, any patient or customer who deals with either of these companies, they need to immediately take a look at their service experience with them. Not only was I ripped off, deprived of my money and time, as you can hear in the videos documenting my case, I went back and tried to communicate the lack of service and errors by their employees. As you can hear in the recorded telephone calls, both of these organizations would not make good on their services to me. They refused to help me get any of this stuff corrected. My rundown of issues with Christ Health Center, Birmingham, Alabama. I believe I received no measurable level of service in my visit. I was charged the same amount of money, $110, to see the doctor and MD as the nurse, a nurse practitioner. Other medical practices around Birmingham, I paid roughly half of that price. Christ Health is partners with Ascension, St. Vincent's Hospital, and it looks like either Christ Health decided to ignore my injury or were ordered to ignore my injury. And I believe this is to protect the reputations and $1 million salaries of the, quote, professionals, unquote, involved. I also believe I may have been patient dumped, and that's a violation of EMTALA, EMTALA, in the course of my seeking treatment. I was a self-pay patient, I had no insurance, and I could provide no stated source of income. Dr. Terry Daniel Smith, MD, outright refused to grant me a referral for an MRI. Just a few days later, I got that MRI. I had to pay cash out of pocket, and broken bone surrounded by infection shows up in that scan. Broken bone also shows up in the CT scan he claims in his notes in my medical chart to have reviewed in detail. I was billed $50 for a hemoglobin blood test and electrocardiogram I never received. And yeah, I think taking money from people who don't have anything, such as myself, is obscene. Nurse Musgraves wrote in her report that she suspected psych etiology to explain my symptomology, and this is absolutely wrong. Broken skull bone is visible in the MRI, CT, and X-ray that I've had done. Nurse practitioner Anna Musgraves agreed to give a referral when I secured my MRI. So I had to go out and find another medical practice with the equipment who could do the scan. I was given 3 avenues of financial assistance to pursue, and all 3 of these led to dead ends. I did not qualify. This is for Ascension, Access to Care, Cooper Green Hospital, and UAB Hospital in Birmingham, Alabama. After I paid $500 cash out of pocket for an MRI at American Health Imaging in downtown Birmingham on the south side, the diagnostic center staff told me that they needed a medical referral. I informed them to call Christ Health Center in Woodlawn. They were put on hold 15 minutes, and then someone, we don't know who, at Christ Health Center hung up the telephone. They backed out on giving that referral. I believe somebody didn't want me to get this MRI scan because it would show the truth of an injury that I was told I did not have. A medical doctor I had no interaction with also strangely edited and signed off on my records and chart days following that visit. This was shortly after I lodged my first official complaint for lack of service from Christ Health. This doctor was Beverly Vanderpool. I put all my records from this visit in several hours worth of video on YouTube channel My Medical Nightmare. You can go there and see my side of this story. Deborah Pickens also tells me that a letter with a statement was going to be put in the mail to me after that August 2023 meeting. And what I can say is I have not yet received this promised letter. 1 year later, they know my address too because they sent me those bills for those medical services that weren't performed on me. So people out there looking at healthcare options in the Birmingham, Alabama area, please take my experience to heart, and I would advise that you look elsewhere when seeking medical treatment from a doctor or a nurse. I'm not exactly an expert at all the buzzwords applied to these scams. Upcoding and phantom billing. These are 2 common healthcare scams that I was apparently a party to as a patient and customer, and this involved Birmingham, Alabama area community health clinic, the Christ Health Center. They were affiliated with Ascension St. Vincent's Hospital, recently rebranded UAB St. Vincent's. The U.S. Federal Bureau of Investigation FBI website describes these scams on its healthcare fraud page. Phantom billing, billing for a service visit or supplies that the patient never received. And upcoding, billing for a more expensive service than the patient actually received. The U.S. Centers for Medicare and Medicaid Services rate both of these scams on the upper level of their scale. Very serious. Also took my issues to the state of Alabama Board of Medical Examiners and Medical Licensure Commission in the form of complaints. I filed a complaint against both Dr. Terry Daniel Smith, MD, and nurse practitioner Anna Musgraves. The state of Alabama would not do anything to help me with these, despite the fact that the documentation that I supplied with these was rock solid. You can see it here in the video. It's their own paperwork, the bills, and the doctors and nurses' own notes. These are part of my medical records. If you only had to deal with Vulcan Imaging Associates and had a billing matter, you might have made off pretty good as a customer and patient, because what happened in my case is I was misdiagnosed and I almost died because their doctors told me that I had no injuries present, despite the fact that I did. Yeah, my experience dealing with Vulcan Imaging Associates and reading about others' experience is they will do and say anything to get your money. And once they got it, they will not speak to you. Their tactics involve targeting affluent communities, subdivisions, neighborhoods around Birmingham, Alabama. They'll go into an area such as Mountain Brook or around the vicinity of the Greystone neighborhood up on Highway 280. They'll sponsor events in these areas. They're interested in clientele who have exemplary insurance, like a lot of corrupt doctors. Once they find security in well-paid insurance, they'll leech on Vulcan Imaging. They regularly reply to reviews and complaints, but the reality is this is simply a token or a procedural issue. Whenever you call the number or attempt to communicate with Vulcan Imaging Associates and the discussion starts to lean toward culpability, liability, or responsibility on the part of Vulcan Imaging and their doctors, as you'll hear in my own recorded call at the end of this video, they'll start making up lame excuses and eventually hang up on you. I was a patient and customer of a Vulcan Imaging Associates doctor, and I'll go into my own situation with what happened to me. I had an MRI of my head handled by Vulcan Imaging Associates and St. Vincent's in Trustville, now UAB, in 2019. In my own scan, I was told I had no injuries. I knew better because I was close to death. Almost died from this. Went and got those pictures. I'll put the pictures up here in this video. As you can see in this MRI, I've got about 6 inches diameter infection inside my head. Vulcan Imaging Associates neuroradiological specialist doctor Michael Brant Ruff, MD, went to school for 10 years to do his job. And he wrote in my records and report, which you can see in this video also, I scanned these in. He said I had no injury present. And so this created a very uncomfortable situation that has yet to be resolved and is outstanding as of this recording, April 4th, 2025. Took these issues to basically all concerned, and they all refused to correct their error, admit their mistake, do a reread. Oh yeah, and they sent me a bill for this MRI, and it was somewhere north of $600. Interestingly, Vulcan was working with St. Vincent's Ascension, who did the scan for me. On November 1st, 2024, Ascension sold this location and 5 other hospitals to University of Alabama at Birmingham, and this whole system has been rebranded UAB St. Vincent's. Why did Ascension sell and leave the area? My story is definitely something that the public needs to be aware of, because the practices that were allowed to occur in the St. Vincent's hospitals and medical facilities were probably enough to shut this place down. Just a personal perspective, my injury and all the complications, my own issue is worth several $millions. Alright, so today we're trying to follow up on the Michael Brant Ruff MRI that I had done in 2019. I was referred to this scan by Northside Medical Associates nurse James Frankie Crum. This is now Complete Health, owned by Pharaoh's Capital. This is located off of Happy Hollow Road, Trustville, Alabama, headquarters in Pell City. Michael Brant Ruff is a doctor who read the MRI for St. Vincent's Ambulatory Healthcare Network, LLC. That's Ascension. If you're following my documentation, you'll note here that in Birmingham, Alabama, we got a real big problem with responsibility, accountability, and radiology. And this week I talked to the two main radiology companies in Birmingham, Alabama. And I recently spoke with Doyle Stewart, CEO of Birmingham Radiological Group. According to their website, they have 38 radiologists who work with them. And here in this call, you'll hear me speaking with Kim Mooney. She is the administrative coordinator at Vulcan Imaging Associates. And she states that they have 37 radiologists who work with them. So if you got radiology issues, you go into a medical practice or hospital, doctor, you have an x-ray, MRI, CT scan, these are the types of doctors, and these may be the actual doctors who will be looking at your scan in the Birmingham area. And according to my findings here, not very reassuring. If your scan is misread, you discover this and you try to seek a redress on these misdiagnosis issues. Not encouraging, my experience here.
You have reached Vulcan Imaging. Vulcan Imaging, this is Kim.
Yes, ma'am. I called last week. I was trying to get in touch with one of your radiologists, Dr. Michael Brant Ruff. I had an MRI scan that was looked at by this doctor in 2019. I got a report with his signature on it saying I don't have injuries. However, in the MRI images themselves, I have evidence of a very serious head trauma-based injury. And I was told last week that you guys would try to have this doctor get in touch with me, so it's been about a week, and I just wanted to see what the status of that was.
Okay, so I did look into this, and based on, there's not anything else we can do, so there's not anything that Dr. Ruff can do to assist you with that, since the report's already been read. So there's not anything we can do.
Well, I beg to differ. This was a $700 MRI scan. This doctor was paid to have this scan looked at, and he did not note the injuries. So he is at fault. And so is Vulcan Imaging.
We stand by that report 100%.
Okay, well, the report is in error 100%, ma'am. Can I speak to somebody in management?
Yes, sir. I am the practice administrator.
Okay, can I speak to the head of the company?
Let's see.
Who's above you?
The chairman of the board.
Okay, well, I need to speak to somebody in authority because you're in error with your statement, ma'am. Not professional.
I am so sorry you feel that way, but we stand.
Well, it's not how I feel. It's the facts, ma'am.
Well, now, if you're what you're stating, we would respond. Maybe if you consulted an attorney to have.
Well, if I can't speak to somebody on the telephone about this, I'd be happy to come clear it up in person.
You're more than welcome to come up here and talk to whoever you need to talk to.
This is a serious issue.
I understand that from your perspective.
Yeah, your excuses aren't going to cut it either, ma'am.
It's not an excuse, sir. I really don't know how to help.
What you should do is, you're in business, all right? Well, you have doctors who went to school for 10 years. They're millionaires, okay? They're reading radiology reports for hospitals and other doctors, okay? What you need to do is you need to have them do their job correctly. And if they miss major injuries in patients that they almost died from, such as myself, you need to simply make an attempt to correct this error. Now, I could get in touch with Dr. Michael Brant Ruff. I could supply my records. He could look at these images again, and we could clear this up in a few minutes. Could I please talk to him?
No, sir, I can't reach out to Dr. Ruff. We don't consult with patients.
That's a very sorry excuse, ma'am.
I'm so sorry. That's our policy. Let's see. What can I do to help you? Let's see. Eric Blackman is my CEO.
Well, why are you mentioning his name? Why don't you just connect me to him? Well, that's pretty convenient, huh?
Well, it's the truth.
Well, I don't believe you.
I'm so sorry about that.
Yeah, me too.
Let's see, what I can do is I can give you, let's see, his direct number is...
How many radiologists work for your company, ma'am?
I have 37.
So you have 37. Why don't you take this scan, call somebody right now and have them look at this scan and correct this issue for me?
But that is not how radiology works. We can only
Yeah, you're not professional. We've already established that.